Good morning and welcome to our Thursday COVID-19 briefing. Today I have with us our Director of Public Health, Matt Constantine, our Chief Administrative Officer, Ryan Alsop, and our Public Health Officer, Dr. Chris Lyon. First, I'm going to hand it over to our Public Health Director, Mr. Constantine.
Thank you, Megan. Good morning. This morning we are announcing 171 new COVID cases in our Kern County residents and one additional death. And today we are hopefully going to receive additional doses, 552 doses to be specific, of remdesivir that should arrive today. It will be in the hands of our hospitals later today, so that's good news. Over the last few days, the state has been providing notification about actions that will be required in a number of counties to scale back some of the reopening. In particular, Kern was identified along with 18 other counties in the state of California, representing more than 70% of the population of the state, where businesses would need to revert back to earlier posture to help control the spread of COVID-19 in the state. So earlier this week, bars were identified by the governor in Kern County that needed to be shut down. Yesterday, the governor announced that restaurants and other businesses within Kern County would be asked to restrict service, in particular indoor dine-in restaurants, indoor wineries and tasting rooms, indoor family entertainment centers, indoor movie theaters, indoor zoos and museums, and indoor rooms. All of those facilities would need to be restricted, and they've required that they be shut down for the next 3 weeks, and then be assessed at the end of that 3-week period, depending on where we fall on the state's monitoring list. We are notifying businesses that are affected, in particular the restaurants and bars. Notification went out this morning to all limited facilities in of the need to adhere to the governor's order. And then finally, I do want to highlight in Kern County our hospitalizations and our availability of beds remain high. 795 beds available in Kern County and 65 intensive care units beds available today. What I would like to do, though, is ask Dr. Lyon, our Kern County Health Officer, to come up and speak a little bit about what he is seeing in the hospital setting and staffing. So I'll turn it over to Dr. Lyon.
Thank you. So as Matt was saying, we do have reported beds available, continue to have available beds for treatment. One of the other factors that play the availability of care in the hospital is staffing. So whether that be nurses, CNAs, all the other people that play a role in providing care, they also are critical to having those beds available. So if we have all but we don't have staff, it does limit the ability to continue to take care of patients. And so there's multiple factors that go into staffing, clearly. There's the stress of dealing with everything, as every one of you is dealing with, as well as we typically have challenges recruiting to Kern County. There's lots of different things that go into this, but it reiterates the importance of trying not to put yourself in a position to get infected with the coronavirus. So it brings home the importance of wearing your mask when you're not able to physically distance, We don't want people to be socially distancing because we need to have interaction as humans. However, we do need to be distanced to try to decrease the spread of the coronavirus. And I'm going to turn it over to Megan now to talk.
Thank you, Dr. Lyon. I want to go through our testing sites because we do have some changes in hours over the 4th of July holiday. The following sites will be closed on the 4th of July. The Arvin location at the Public Health Building, the Kern County Fairgrounds drive-through, Go Library location, the Rosamond testing site, Oildale and at the Good Sam Hospital will be open from 6 a.m. to noon. Taft will be closed. Delano is typically closed on Saturdays, so that holds for the holiday as well. And that is also true of Kern River Valley, Ridgecrest, and Tehachapi. And our Lamont site will be closed on the 4th of July as well. So if you testing site, the only one that is open on the 4th of July is the Oildale location at Good Samaritan Hospital. We are continuing to see a positive trend in our testing numbers. We are up over 17,000, specifically 17,527 tests at our state and county funded sites. So we want to thank our cities and private partners for all of the help in getting this message out. With that, I'll turn it over to Administrative Officer Ryan Alsop.
Good morning, everybody. We have 67,000 Kern County residents for COVID-19. 62,000 or 92% of those tests are negative. We're seeking the result of a little over 701, or about 1% of the total number tested. And today we have 4,939 residents, or about 7% of the total number tested, testing positive. 4,939 residents who've tested COVID-19, 4,762, or 96%, are either fully recovered or they are isolated and recovering at home, treating their symptoms on their own. Again, this has been a percentage that has remained consistent on a daily basis since early March, really the beginning of our keeping track of how this virus has been impacting our community. Today, 102 residents, or 2% of those that are receiving some form of care in an area hospital, and 77, or 2% of those who've tested positive have died. Real quickly, the governor, as Matt said, has shut down industry in counties. We are one of them. These are counties that have been on the state's monitoring list for 3 consecutive days. The governor first ordered all bars closed. You cannot operate indoors or outdoors if you're a bar. And he is requiring the immediate shutdown of dine-in restaurants and wineries and tasting rooms and movie theaters, family entertainment centers, bowling alleys, miniature golf, batting cages, things like that, zoos, museums, card rooms. He has ordered closed. And it will be very important for us to continue to work with the industry to know that these orders have been made and what they are, the details, and to make sure everybody is adhering to them. The Kern Recovers Loan Program, this is a forgivable loan program for small businesses in Kern County. $13 million in funding out to 492 businesses across 180 different industries. Average loans about little over 25,000. 15 days from the time of application to the time money is received. We are announcing today that we are opening the program now to people who have received PPP. However, there is a criteria. We are specifically targeting those industries the governor has just closed down again. So the governor has ordered those industries that I just talked about, dine-in restaurants, wineries and tasting rooms, movie theaters, family entertainment centers, zoos, museums, card rooms. If you have received, if you're those groups and you have received federal financial assistance through the PPP program previously, you are eligible to financial assistance from Kern County through the Federal CARES Act. Please go to kerncounty.com for more information. And so yesterday we launched our PPE, Personal Protective Distribution Program. The information on that program is at kerncounty.com. Again, it's a $5 million program targeting 5,000 independent small businesses throughout Kern County to supply them with an array of personal protective equipment, masks, gloves, sanitation, hand sanitizer, et cetera. Again, you can find out how to get that equipment and how to apply and where to get it at kerncounty.com. And with that, we will take your questions.
Thank you, Ryan. Okay, as usual, we're going to follow the list that was sent out to all of our reporters. We do have a high number of reporters on the line today, so I'm going to ask that you get directly to your question, and that will allow us to let several of you ask more than one question. So please, if you could get directly to the question, we would appreciate that. Remember, it is to unmute. Stay unmuted until we call your outlet. Our first organization is the Bakersfield, California line.
Hello, this is Sam with the California.
Hi, Sam, go ahead.
Yes, my question is that the county has said over and over again that the primary cause of infections has been among people living in the same household. So I'm wondering, do you guys expect the governor's order to shut down these businesses again to have much of an impact on the rising number of cases here in Kern County?
Question, Sam. Give us 1 second while we figure out the best party to respond.
Sure.
We're going to have our lead epidemiologist, Kim Hernandez, respond to your question. If you guys are wondering why sometimes it takes us to answer these questions, it's actually because what you can't see outside the frame is a bunch of social distancing, and so it takes us a bit of time to get to the podium. So thank you for being patient with us.
Hi, Sam. As we have previously mentioned, that we do see a number of cases that come out of households, but obviously that first person transmitted in that household. So we are hopeful that the recommendations from the state will help stem the spread that we are seeing in our community. We encourage everyone to follow the recommendations that are coming down from the state.
Thank you, Kim. Sam, were there any follow-up questions?
Yeah, I just had one, and you guys probably won't be able to answer it today, but I was wondering, is there any information that you guys can put out on the happened, like an age range or something along the lines of the demographics that you put out for cases?
Let me make sure I understand your question correctly. You want to know whether or not our public health department would ever release specific demographic data related to the death?
Yeah, like what's the age range for the people that have died, like people 50 to 60, people 40, like that sort of thing.
Okay, I think Kim will respond to that. Thank you.
Hi, Sam. As we've mentioned a couple of times, at this time, the Public Health Department is not able to release additional identifying information on people who have died. We do have to tell you of them as part of identifying the number of people who may be infectious in our community, because obviously people who have unfortunately died are removed from that number, but we are not at this time able to provide additional information on individual patients who have lost their lives to COVID.
Thank you. Okay, our next outlet, Kern Radio. Anyone on the line?
Gerald Flores from Kern Radio.
Hey, JR, go ahead.
Hey, Megan. My question, is it public health, are they mandated for businesses to report an employee positive case? So does public health mandate that a business, once they have a employee test positive, to report that to public health?
That's another question for Kim, so we'll have her come back up. Give us 1 second.
Hi, JR. In regards to your specific question, we do not require employers to report positive cases to the Public Health Department in and of itself. We encourage employers who may have questions to call us because we do have a number of people who help support them through that decision. Obviously, just because an employee has tested positive does not mean that there has been an exposure in the workplace. And so for many instances, we help work through that, help them identify whether there or not there is a concern for exposure in that workplace. Those who are required to report positive cases to us are our healthcare providers as well as our laboratories. There also is a general requirement in public health that if you are suspicious of an outbreak or think that you are in an outbreak, that those are also reportable by our healthcare providers and our laboratories. Thank you.
Any follow-up questions, JR?
Yeah, what health procedure for contacting an individual once they have tested positive? How long does it typically take for public health to make contact with that person? And how far back from the test day do they trace back? And how long does it take to contact those individuals that have possibly been exposed?
I think it's going to be the Kim show today, so we'll bring Kim back up.
Hi, JR. Our general process, which has been going on since the beginning of COVID-19 in Kern County, is that once a patient is identified with a positive laboratory report, our public health nurses reach out to that patient and go through an interview process to find out where that person may have been and where that person identify people that may have been exposed to this person. A lot of the time factors depend on a number of things. One, first the report getting to the Public Health Department, that it is indeed completed, it has the information we need in order to contact that patient, whether or not that patient is available when we try to contact them, and if they are willing to speak with us. And sometimes that takes some time to find people when they have an appropriate moment for us to talk. In that process, we identify a number of things about those patients, and in particular, a lot of the time our nurses are educating those patients because a lot of people have questions and concerns and anxiety diagnosis. So they spend a lot of time educating those patients as well as helping them identify resources in our community that they may need. When contacts are identified, those contacts are also contacted by our staff at Public Health to make them aware that they may have been exposed to someone with COVID-19, that they need to quarantine at home and watch for symptoms so that they can take additional protective measures in their own home to avoid exposing others. The timing of identifying contacts, obviously we are looking for contacts who were around the positive case while that case was infectious. A lot of the timing right now has to do with the laboratory results, because we do know that it takes a few days for patients to get their results. So even though the patient is doing the right thing in staying home and isolating while they're awaiting test results, until that result is positive, the Public Health Department is not able to initiate any of that other follow-up. We are hopeful that people are hearing from their healthcare providers as well as our testing sites that while their test is pending, home and isolate, particularly if you have symptoms. Obviously, anybody who is symptomatic should be staying home, but that while they wait for their results, they should continue to self-isolate and also think about these things of identifying people who they may have been around during their infectious period. Thank you.
How far back, though, from the day of the test, once you do find out they're positive, from the day of the test, how far back do you?
So we trace back not based on the test date, but on the symptoms of the patient to identify when that person may have first been infectious. And then so we, in talking with that patient, when they're symptomatic, we identify that infectious period. And so then we notify contacts who they identify being in close contact with them. And that close contact, again, is within 6 feet for or more. So those close personal contacts who were around the positive case while they were infectious, those are the people who get notified by public health.
And how many from when they're showing signs of infection?
Sorry. So a patient is considered symptomatic from 2 days prior to their symptom onset through their duration to be released from isolation criteria. So typically for most people, from their symptom date, we count back 2 days, and we're looking for all of the people that they have been in close proximity to during that time period.
Thank you.
Okay, our next out, 23, anyone on the line?
Good morning, this is Tori.
Go ahead.
Can you hear me?
Yes.
All right, so we have 2 questions this morning. Some of the stuff that obviously transpired yesterday. From the calls you guys are receiving businesses, what's the general reaction just in light of the recent closures?
On to your question, Tori.
Tori, good morning. So the call center has been active. We received a number of calls from beginning on Monday from businesses, of course, expressing confusion, frustration at times, asking for interpretation of what this means to their business. The order applies to bars and applies to there is on at times if a bar is within a restaurant, how does that apply? State law doesn't distinguish the difference between those facilities, so we've had to try to work through that with them. And it's a varied response. A lot of businesses, a lot of people calling in about just general questions, but they get hundreds and hundreds of calls every day. Tori, does that answer your question?
Yeah, overall, I would say that answers the question. So there's been a lot, just to clarify, there's been a lot of confusion. And so, for example, places like Sandrini's, it's a restaurant, you can get food, and it's a bar. So as of now, unless they have outdoor seating, they cannot.
Correct. I couldn't quite hear all your question, but that is correct.
Okay. And then the last question that I have today is, have more businesses applied for the special COVID permit where they can operate a site to help allow for social distancing?
So, Tori, are you asking if for example, if a restaurant has applied to a different location that offers more seating? Did I hear that right?
So the special permit, the COVID permit, the one that allows businesses to operate outside of the footprint?
So, Tori, I'm maybe Ryan can answer. I'm not familiar with a COVID permit. I think there was discussion early on about ways to maximize outdoor seating, working with local zoning entities to try to get that achieved. Is that your question?
Okay, so maybe there's a difference, but from what I understood is if you wanted to, say, operate your business in a parking lot with some people so that you can help allow for social distancing, you could apply for a permit. Maybe we have something incorrect.
No, you're generally correct. I think we're on the same line here. So I'm not aware those permits go through either the building department or the planning departments for each city and county. I know there was interest early on. I think now with these restrictions, there'll be some new interest in doing that. But I think you've heard both from the city of Bakersfield and the county of Kern. We stand ready to assist in that process. There are some issues you have to work through if you want to put up a tent. There's some fire department rules we have to work through. But I think at a recent board meeting, you had complete commitment from the fire department, planning department to assist in that process. I don't readily have numbers, but again, since the restrictions have been put in place, we stand ready to assist businesses in trying to find out every way we can to allow them to continue to operate during these difficult times.
All right. Do you think I can get those numbers from you later?
I would, Tori, I would encourage you to talk to the local building departments in each city and Kern County Planning. They can probably provide you some better information than I can.
Okay.
Thank you.
And then the last question that we did have, I don't know if you guys have time, I haven't heard anyone ask this. We've been receiving numerous reports from people complaining that many of the law enforcement officials are not wearing masks when they're out there. I know that the Public Health Department has been very adamant on making sure that they are telling everybody to wear a mask. Do you guys have any response to that? Are you guys receiving those calls as well?
Tori, our response on this one has been the same the entire time. Our suggestion is that you reach out to the law enforcement agencies themselves. They do have policies and procedures in place. We did speak with the sheriff on this one, and so my suggestion is that you call him so that he can walk you through the specifics around how their deputies unmask and when it's required. Thank you. Okay, our next outlet is Kern Soul. Anyone on the line?
Hi, good morning. Elizabeth from Kern Soul News. My question is about what Dr. Lyons was talking about regarding staffing in our local hospitals. I was just curious, do we have a shortage of staffing in hospitals? And if we were to reach capacity, I know we looked at a model last month that said we would reach it at the end of this month if nothing changed. If that were to happen, what staffing in our local hospitals?
We're going to have Dr. Lyon respond to your question. Give us 1 second.
Okay.
So thank you for the question. And unfortunately, there's no absolute answer for that. Staffing is always a challenge in Kern County. It's even more so during a pandemic like this. We are in frequent communication with hospitals and the nursing homes to try to help facilitate staffing where we can, but it's definitely something that is a concern, which is why I brought it up, in the sense that if we don't have staff, we can't staff those beds, which does then potentially capacity and our ability to treat people, which again goes back to the importance of physically distancing, washing your hands, wearing your masks.
If you've been in contact with the hospitals, have they been telling you that they are short-staffed?
So the question was, have the hospitals indicated to our public health department if they are short-staffed?
Yes.
Okay, hang on 1 second.
Elizabeth, good question. Yes, we hold routine meetings with our 10 acute care hospitals. We want to make sure that we are doing everything we can so that they are able and staffed and they have the resources to care for our community. Staffing is a concern. Today, they are okay, but as we had a meeting last night, they do indicate that staffing, specifically nursing, is a limiting factor that is going to present some challenges for us. So on a county level, we are exploring any potential ability to help our local hospitals on providing adequate staffing. This is kind of a dynamic field. The hospitals are good at managing this on a daily basis. Of course, the pandemic is putting additional stresses on the whole system, and everybody is affected, not only our 10 hospitals, but the state and the whole country. So there are some for us. We're going to continue to monitor that, but it's another area that we need to watch and carefully manage. Hopefully that answers your question.
Thank you, Matt. Thank you, Dr. Lyons.
Okay, our next outlet is Valley Public Radio. Anyone on the line? Don't forget it's *6 to unmute. Okay, we'll go on to the next outlet. If we need to come back, we will. Channel 29.
Hi guys, Tim here with Channel 29. One thing I wanted to ask you is, Ms. Hernandez was talking about the spread within households. One thing that the governor has been talking about is that places like bars and indoor places like that, young folks are going out and perhaps acting irresponsibly, and that's causing a rise in the numbers. Is that something that is also being mirrored here in Kern County with bars in particular and the young folks, or is that somewhere where we deviate from the rest of the state?
Hey, Tim, that is a Kim question. Give us just 1 second. She
Sure.
makes the long walk.
So as we've mentioned, we do know that this transmits pretty readily in a household. We do know there are concerns within our community. We have a great deal of concern of anybody, regardless of age, who are not taking all of the recommendations seriously, whether it's gathering at a bar, whether it's gathering somewhere else, that when you are with people who are not of your household, you increase that risk of being exposed to someone with COVID-19, bringing it into your household and affecting the rest of your family. We don't have, in Kern County, we've had a number of complaints and reports of people specifically related to bars, but we've had lots of complaints and reports for other locations as well. So we in Kern County locally have specifically to young people in bars, to answer your question simply. But we do have a lot of concern with anybody of any age who are not abiding by the state's recommendations to limit contact with others and to help all of us slow COVID in our community.
Right. And Ms. Hernandez, what about the protests? Because I know nationwide there's been a debate over whether or not they contributed. Do you think there's a contributing factor between the folks who are out there protesting and the rise we've seen in recent weeks here in Kern County?
So Tim, I think what you're asking is whether or not the protests, we saw a correlation between the protests and a rise in cases.
Yes.
Okay.
At this time, we don't have data that indicates here locally that protests contributed to the rise in cases we're seeing today. We do know that at a state level, they've been looking into this very closely. But of course, we know it can be difficult to attribute to specific events because that also happened around the time of Memorial Day. This is also happening as things are reopening. So here locally, we don't have evidence that points specifically that says protests increased our cases. But we do have a lot of indications that in general, and as things have reopened, that increased mixing of people has likely contributed to the cases we're seeing today.
Great. And I have two more quick questions if we have the time. Throughout the process, I believe Ms. Pearson said this, you guys have been that you guys are strongly recommending people physically distance, that they wear their mask, but we've stopped short of like an actual enforcement. And I appreciate that you guys can only do so much. Is that going to change if these numbers continue to go in the direction that we don't want them to go to?
Thanks for the question, Tim. Give us 1 second to bring someone up for you.
Hi. Yeah, we're going to continue to do what we've done all along, which we think is working very well in our community, and that is continuing to reinforce with the people that live in Kern County and the business rate in Kern County, no matter what industry that you're in, no matter whether you're closed or you're open, working with adaptations and under guidelines, reinforcing the state public health directives, orders, guidance, recommendations, considerations, all of the above. We think that, again, that has worked very well. We have been in that mode for some time. As Matt pointed out earlier, we are in constant communication with a wide variety of industries. Our public health group is communicating now with industries being impacted with this recent order, and we'll continue down that path until we need to change it up. That means, but it's a fluid situation. Every week is different with the virus. It seems the state's got a different plan each week or every 2 weeks. And so this is a very fluid, fast-changing situation. We appreciate the folks in our community doing everything that they can with us, their patients, listening, using good judgment, particularly our business owners who are operating under these guidelines. Thank you for all of your participation and cooperation.
Right, but we're not going to be fining folks, because I know some places are looking at stuff like that.
No.
Okay. And
Sorry,
then
that's
final
the short
question really
answer I'm
quickly
getting from the
is-
side. Thank you, Tim.
That's great. That's all I need. And my final question really quickly is, if these numbers continue to go in the direction that the state doesn't want, have they communicated with you guys what might come next? Is it going to be more businesses have to re-shut down, or what are the next steps if we don't unfortunately move in the right direction?
Tim, they have not communicated with us, and they historically haven't done that. I think Matt announced at the, I can't remember if it was the board meeting or one of our last press conferences, that we literally find out sometimes hours or minutes before the governor makes an announcement, if at all. So unfortunately, we don't have a read on that, but thank you for asking the question.
Thank you for your time, guys.
Anytime. Channel 17.
Hey, everybody. Good Thursday morning to you. Eitan Wallace here. Two questions. First, on the reported death yesterday, then I'll ask Mr. Alsop on the Kern Recovers program. Quickly on the deaths, 6 deaths were reported yesterday. To clarify, did all these deaths take place in one day, or were they over a few days and just reported on one day? And can you confirm how many of these deaths came from nursing?
Eitan, we're going to have Kim respond to your question. And I think they may need to actually get some data, so give us just 1 second to pull everything together. But here's Kim.
Thank you.
For the number of deaths that were reported yesterday, no, they don't all happen on the same day. Every death that is reported goes through a process of evaluation to ensure before we put it on our dashboard that it is a COVID-related death. You can think of some scenarios, for example, if somebody had COVID-19 but they were in a horrible car accident, that would not be considered a COVID-related death. And so we make sure that they do meet the criteria to be counted as a COVID-related death before they are added onto our dashboard. So they don't all appear in one day. If you look closely at the dashboard, you will see that the number of deaths change a few days back, so it will get updated so that we routinely check to make sure that they are COVID-related before they end up on our dashboard. Overall, out of our total number of deaths, 30 of them have come from our skilled nursing facilities.
30 out of the 30 out of the 70. The 76 or whatever. Mm-hmm. To be okay. Thank you. That's that on the death. When it comes to the Kern Recovers program, Mr. Alsop was talking about it earlier. I was trying to take notes. I just wasn't able to get all of the information. Any chance you can talk about just the general average loans, how much money has been sent out, and how many industries have benefited?
Yeah, I'll have Ryan respond to that.
Well, thank you for giving me the opportunity to once again highlight the Kern Recovers program, the forgivable loan program, Eitan. I want to remind you and everybody that's watching, you can keep track real time of all of this information. It's found kerncounty.com. There's a link that says Kern Recovers. If you click on it, you can actually look at this, how we're distributing this financing and where. It's quite detailed, and that's updated in real time. But Eitan, to your question, over $13 million in funding has been distributed as of just before we started this morning. It's gone to 492 businesses throughout the county. Those businesses represent about 180 different industries that we have in Kern County. The average loan that has been provided out has been a little over $25,000. It's taking about 15 days from the time an application is sent in to the time money hits bank accounts. I want to take the opportunity to thank the 4 lending institutions that are partnering with the county to make this happen. You do not have to be a member at these banks. Find out who they are, again, at kerncounty.com. Again, I'm going to take the opportunity, if you are a business that is being impacted by the governor's recent directive to close, if you are in any of those categories, restaurants, bars, family fun centers, wineries, tasting rooms, things like that, and you have received federal financial assistance due to COVID through the PPP program, you are eligible now today to receive financial assistance from Kern County through our Kern Recovers program. We're targeting you, given the governor's recent order. You can get information today at kerncounty.com. Please go there and apply. Thank you.
Ryan, thank you. And my final follow-up question for Ms. Hernandez. I'm not sure that I actually heard, were you able to indicate how many of the 6 deaths reported yesterday were from nursing facilities?
I'm sorry, Eitan, we're not able to report that, just the total number.
Thank you.
Okay, our next outlet is Telemundo. Anyone on the line?
Hello?
Hello, we
Hello,
can hear
hello?
you. Go ahead.
Yeah, Jose Gaspar here. How you doing?
Well, how are you?
Okay, so I have a question about the restaurants, the enforcement action here. As you know, obviously the governor's order says that no indoor dining. However, what about those restaurants who have remained defiant and may remain with indoor dining? What, if anything, will Kern County Public Health do about that?
1 second. We'll have Matt respond to your question.
Jose, good morning. Our position remains the same. I know this is a confusing time, so we feel it is our obligation to get all the information out. We have been fielding calls, sending emails. Today, we sent an email to every permitted facility that we have, giving them specific information on how to comply. 99% of our businesses comply. There's some that there is a confusion on how to comply with the state order. I'll be honest, it's confusing for us, distinguishing between bars and restaurants, and the order that came out on Monday and the order that came out on Monday. So it's natural to assume that there is confusion on this. We are going to work with them, going to do everything we can to ensure that they understand the order and the reason behind the order, that this helps us, it helps the residents, it helps the employees, it helps our compliance overall, it helps other businesses stay open, it helps flatten the curve and address the hospital. So in that vein, we are able to achieve compliance.
But the order says no indoor dining.
Correct.
Okay, so what's so confusing about that?
So the fact that there's no indoor dining in itself is not confusing, but distinguishing between a bar that has to close and a restaurant that doesn't, or Can a chair be placed in a restaurant so that people can sit at the chair while they place an order or they go through the line? So there is confusion, Jose, at times on understanding that. Now, as you saw from the governor, they have established a strike team that's made up of a number of different licensing agencies, and the governor indicated that that strike team could be used to provide enforcement if needed at the local level.
As far as you know, are those strike teams coming here to Kern County?
We have not been provided information. We have seen previously that the state licensing agencies were active in Kern County and did respond to facilities. So my assumption is there are facilities that are not complying, that would be an entity that could respond. Specifically, they've also talked about a coordinated response and a coordinated phone number. So the thought is a way for our community to get information directly to the governor's strike team that could enforce the governor's order.
Will you be requesting that strike teams come to Kern County?
It has not been given, the county has not been given that option yet. I think that if there are businesses that do not comply, I think that is reasonable. But in the past, we have seen high levels of compliance in Kern County, Jose.
All right. When you say the county has not been given that option, I mean, you guys don't have to wait to get permission. I mean, you can call up the governor's office and say, we'd like a strike team to come to Kern County. You can do that, right?
Yes, sir. That could be an option. That once the strike team is further consolidated and we have more information about how to contact, in particular, who is the lead. You know, we've read that Cal OES is going to actually be the one managing this. We do have routine calls with Cal OES, so there likely will be an opportunity for us to help identify areas that we're struggling with.
All right. I have another question about the outbreaks at workplaces. What constitutes an outbreak? At what point do you guys say we need to intervene in a work site?
So I think I'm going to ask Kim Hernandez to see if she can assist us, Jose.
Okay.
Hi, Jose. In a general sense, for an outbreak, we're looking for ongoing transmission at any given point in time or place. For all of our workplaces who do have cases, we encourage them to reach out to us. We reach out to many of them to make sure that they have the best practices instituted, that they are following recommendations, work through some of those processes to reduce the risk of additional exposure in the workplace. We know since incubation
Yeah, I mean,
period
is there a certain number before you guys, is it 5, 10, 15? At what point does public health say we need to get involved here?
So we are happy to be involved with one case. So we don't have a specific number. We recognize that in many workplaces, they have multiple people from the same family that work in a location. And so we work through each of these pieces of it with every employee to help mitigate any risk in the place of employment, as well to help and provide education to their staff members to help continue to reduce their risk at work as well as in their personal lives.
But do you wait until they call you, until they invite you to go in, or do you take the initiative upon yourself and say we need to get involved here?
It happens both ways. So we can be made aware of them complaints through our patients, and we reach out to those employers actively to get information from them to see what kind of information they have to help them through this process. Or we have employers who do call us and reach out to us proactively, and we've had many do that throughout this time.
All righty. At Primex in Wasco, as you know, the company admitted they had at least 31 tested employees positive. Now the workers are saying that that's going up to 77 additional total cases. And then, as a result of that, 33 family members have tested positive for COVID-19. My question is, are you guys specifically working at Primex looking into this outbreak there? Hello?
Yeah, sorry, we heard your question, and Kim's going to respond. Give us just 1 second.
Hi, Jose. To answer your specific question, We have been working with Primex. We have reached out to them, they have reached out to us, and we have been working with them to help identify, additional close contacts, to notify those close contacts, to help them provide education to all of their staff. So we have been involved in many other businesses throughout this time.
How many workers have you identified, total number now impacted by COVID-19 at Primex?
Jose, I'm going to go to our next outlet, and if we circle back, if not, we'll have you with Public Health to get the answers to those questions. Thank you.
I will get an answer, correct?
Correct. If they're able to give you one, they will. Our next outlet is KNZR. Anyone on the line?
This is Tony Lee from KNCR.
Hi,
And
Tony.
I guess I want to go back for a minute to the beds available and the ICU beds available. If I got the number right, it's 790 beds total available in the county and 55 total ICU beds available in the county. Is that correct?
Your ICU bed number is correct. The total number of beds available is 795.
795, okay. Now, what would happen, staff is the problem. So it's not that we don't have beds for patients. What we're trying to do, I guess, is to keep the number down to the point where there are enough beds for the patients. But what I heard you say is that there's not enough staffing for the problem, especially nurses. So what can we do about that?
Thanks for the question, Tony. I think we're going to have Dr. Lyon respond. We're trying to figure out an answer really quick.
Okay. Mm-hmm.
So as we were saying before, we've been working with the hospitals, trying to interact with them to find ways to help with that. Unfortunately, there's no simple answer for staffing. If things were to get worse, there are teams, DMAT teams, so state and federal resources to help with. We are not at that point yet. The main thing here that I keep trying to come back to is the importance to do your part to stay healthy. So wearing your mask, physically distancing, washing your hands, and if you have to come to the hospital, you must wear a mask to protect our healthcare workers.
Okay, what I'm concerned about, though, is in the fall, because I understand that in the fall we're expecting another spike. If we're already having a spike and we're having trouble handling, we don't have enough nurses, what are we looking for in the fall? What do we expect?
Hang on, Tony. We'll have Matt respond.
Tony, good morning. So I'm not going to call this a second spike, but as the model has been projecting, our average number of new cases continues to go up on a daily basis. We have identified that ICU beds could be a limiting factor for us. We are worried about what the future holds. Again, I think we've made tremendous strides in reducing the number that potentially could impact our hospitals, but that presents a challenge for us. So that's why we're here twice a week. That's why we're really wanting to take every action we can to keep those numbers down. But as we have projected, come later this summer or even later this month, we may potentially even exceed our capabilities. Staffing is a whole nother area. It's harder to put a hard number. The state has relaxed some of the staffing ratios, but as our hospitals tell us, these individuals that are in the ICU require a level of care, and they are not able to reduce staffing levels. So staffing is going to remain a concern to us, and we're exploring all options. Everything's on the table. We're in this together, but we don't have an easy solution today, but we are indicating that this is a problem that we're going to have to watch out for in the next few months. Anything more, Tony?
Oh, no, that's it. Thank you very much.
Okay, that was our last outlet. We did have a higher number of questions today, so we're going to go ahead and wrap up. That will be the close of our Thursday COVID-19. We'll see you guys next week. Please have a safe and happy